Everyone, good to see you all. We are your athletic trainers. My name is Nate Aiken, and this is Brashit Tarmani. We're both your athletic trainers here at Chaffey College Athletics. So we are doing a COVID-19 educational session that all of you are required to go through and be familiar with. Make sure that you pay attention throughout the entirety of this. I know we've been dealing with this for a while, so you might feel like you know everything you need to know, but it's our job to make sure that you know everything that's necessary to keep everybody healthy and safe as we begin our season. Okay, so quick overview of this presentation. We're going to go over what COVID-19 is, ways to prevent it, some myth busters, things that people believe that may not be all the way true, treatment for COVID-19, some personal responsibility items of what your role is within your team in relation to COVID-19, and also some fluidity items as well. Okay. So COVID-19, coronaviruses are a large family of viruses common in both people and animals. Most common coronaviruses cause the common cold in humans. This might be a little bit older than some of you are, but COVID-19 is caused by a virus that has been named SARS-CoV-2, which is in the same family of viruses as SARS and MERS, which were, earlier in our lifetimes. COVID-19 is a respiratory disease that is being spread by a new coronavirus that emerged in 2019. It affects both the upper and lower respiratory tract. It is a virus, meaning that there's no medication or drug to cure COVID-19. So really what helps it most is time and treatment of symptoms. So medication is only for treating of symptoms, not for curing the disease. These are the most common signs and symptoms, but this is not an inclusive list at all of symptoms that present with the illness. You've got cough, fever, repeated shaking with chills, headaches, loss of smell, severe vomiting, shortness of breath, chills, muscle pain, sore throat, loss of taste, and diarrhea. Just because you are not in the high-risk group doesn't mean that you can't contract COVID-19 and suffer complications. Everyone can contract COVID-19 and transmit it. It's very common for people to think that they're in the clear, and they end up with a case that's far worse than they expected. So some of the high-risk groups can include chronic lung disease, moderate to severe asthma, serious heart conditions such as coronary artery disease, congenital heart disease, and cardiomyopathies. That's a very common one in student athletes, so that's one to be aware of. Immunocompromised individuals, severe obesity, diabetes, chronic kidney disease, and liver disease. So all of those can be serious complications. People who are more likely to suffer severe illness from contracting COVID-19 include people who are 65 years or older, people who live in nursing homes or long-term care facilities. Most of us, have had to take a guess, know someone who's in one of those two categories. And so preventing you from getting it is a great way to protect those people. Many of you live with, know, or come in contact with these high-risk category people all the time. It might be grandparents, family, friends, etc. COVID-19 can cause complications that affect multiple systems in the body. The complications include, but are not limited to, acute respiratory failure, acute respiratory distress syndrome, viral pneumonia, acute kidney injury, acute liver injury, secondary viral and bacterial infection, septic shock, abnormal blood clots, and those can lead to pulmonary embolisms or stroke. So COVID-19 complications can be very serious. COVID-19 is transmitted a couple different ways. So person to person is the most common. So this is between people who are in close contact with one another. Respiratory droplets produced when an infected person coughs, sneezes, or talks. Those droplets can land in the mouths or noses of people who are nearby or possibly be inhaled into the lungs. COVID-19, most importantly, can be spread by individuals who are not showing any symptoms. Then the other way that it can be spread is by contact. So by touching a surface or object that the virus is on, and then touching your own mouth, nose, or eyes. The amount of time that the virus can live on surfaces depends on the material of the surface. So for plastic and stainless steel, it can live for up to 72 hours. On copper, it can be less than 4 hours. On cardboard, it's less than about 24 hours. Prevention. So all of us are aware that large events and mass gatherings canceled all this year. There's a reason for that. It's because prevention of the disease is contingent on avoiding those events. We want to avoid close contact within about 6 feet with sick individuals. We want to wash hands with soap and water for 20 seconds or use an alcohol-based hand sanitizer made with at least 60% alcohol. We want to avoid touching our mouth, eyes, and nose. We want to avoid sharing personal items, which include water bottles. So we never want to share water bottles outside of COVID, but with COVID being here, all the more reason to not share water bottles. We want to clean and disinfect high touch surfaces as needed. That includes tables, doorknobs, desks, sports equipment, etc. Most importantly, we want to avoid going to work, school, or gatherings if you are sick. This is not the time to tough things out. If you have any of the symptoms that we listed above, just stay home, contact your coach, contact us, let us know that you are sick, and we'll get you going in the right direction. Here's a little video on some hand washing techniques. This doesn't have any sound, but I'll narrate over it. It's from the CDC on hand washing. So we want to use soap and water to wash our hands because soap and water washes off germs or kills germs. Doesn't really matter whether you use warm or cold water. Warm is better, either one is fine. Same thing goes for bar soap or liquid, either one is good. Soap does not have to be antibacterial to work, but obviously that's better, but something's better than nothing. If you don't have soap, but you have access to water, water is fine. Obviously soap is gonna be better, but I'd rather that you washed your hands and dried them off or use a alcohol-based hand sanitizer that contains at least 60% alcohol. When washing your hands, you should scrub for at least 20 seconds to be most effective. Cleaning underneath your fingernails is also important as well. So just peeling back the nail bed, getting some water and soap underneath there or a hand sanitizer. Either towel or air drying is fine, but make sure that if you're using a towel that it's clean. There isn't a lot of scientific evidence about using a paper towel to turn off the faucet or open the door of a restroom, but it's not a bad idea. Again, if you don't have soap or water to wash your hands, using a 60% alcohol-based solution hand sanitizer is going to be the way to go. We'll have those on campus for you. Always make sure that you wash your hands before eating or after using the restroom. That's a picture of some nasty hands. Protect yourself and others by washing your hands with soap and water. That's probably the most important thing, is that it's not just about you, it's also about others as well, okay? And I'll turn things over to Brush.
Thank you, Nate, I appreciate it. That was really helpful. Again, as Nate mentioned, my name is Brashit Tarmani. You can call me Brush. I'm your other athletic trainer at Chaffey College, and I'm going to cover prevention and some of the other aspects of COVID-19 with you. So how to properly wear a face mask. You want to make sure the correct side of the face mask is facing outwards, and you want to make sure the strings are actually behind your ears to hold the face mask in place. When the face mask is on, you want to make sure that the metallic band or strip is firm against your nose to prevent anything from going in. And then you want to make sure that you cover your nose and mouth, and we're not just covering the mouth and leaving the nose open, because droplets can go in that way as well. So covering the nose and mouth is very important. So of course, wearing a face mask, right? And then when you have the mask on, you want to avoid touching the front of the mask and then touching something else. So when you do touch the mask to move or adjust it, you want to wash your hands, of course. And then when you're done using the face mask and you're not around others, you want to use the strings behind your ears to pull the face mask off. And after you're done, washing your hands as well. So COVID-19 versus the flu or your common allergies. So coronavirus can include fever, cough, shortness of breath, or difficulty breathing. Symptoms may appear 2 to 14 days after exposure, whereas the flu, you have the fever, cough, muscle aches, fatigue and weakness, chills and sweats, congestion and sore throat. And then your allergies, you have the sneezing, itchy nose and eyes, or the roof of the mouth, runny or stuffy nose, and then watery, red, or swollen eyes as well. So some of the myth busters. There are currently no drugs licensed for treatment or prevention of COVID-19. Adding pepper to your soup or other meals does not prevent or cure COVID-19. COVID-19 is not transmitted through houseflies, mosquitoes, and spraying and introducing bleach or other disinfectants into your body will not protect you against COVID-19. Drinking methanol, ethanol, or bleach does not prevent or cure COVID-19. And then cold weather or snow cannot kill the new coronavirus. And then as well as the high temperatures or humid environment does not prevent the spread of COVID-19. And of course, last but not least, drinking alcohol will not protect you against COVID-19 either. Treatment. So what to do if you do get sick? You want to stay at home except to get medical care. Most people have a mild illness and can recover at home. Do not leave unless it is to seek medical care, and avoid public areas. Get rest and stay hydrated. Take over-the-counter medications such as acetaminophen to help with the symptoms, and then stay in touch with your doctor. Avoid public transportation and separate yourself from other people as much as possible. You want to stay in a specific room and away from people and pets in your home. If you must be around others, make sure you are wearing a face covering. Some more on treatment. Monitor your symptoms. Keep track of all your symptoms and be aware if they worsen. If your symptoms worsen or you believe you have an emergency warning sign, seek medical attention right away. These are some of the emergency warning signs, or so-called red flags: trouble breathing, persistent pain or pressure in your chest, new confusion, inability to wake or stay awake, and bluish lips or face. So personal responsibility. If you get sick, even if it's just a cold, stay at home and stay away from teammates and coaches. Notify athletic training staff and coaching staff about any illnesses or exposures that may have happened. Sneeze and cough into your elbows or a tissue. Wash your hands often and use hand sanitizer if soap and water aren't available. Wipe down high-touch areas such as doorknobs, cell phones, tablets, and tables, as well as shared practice and game equipment. Wear a face mask if you must be outside while sick. Ensure that the mask covers your nose and mouth, and be honest about how you're feeling and who you've been in contact with. Again, like Nate mentioned, this is not the time to tough it out. You want to be honest about the symptoms you are feeling. Follow rules and restrictions of athletic training clinic at all times. And when in doubt, ask us or a coaching staff any questions that you may have. So fluidity of the situation, right? Remember, COVID-19 is an illness caused by a novel coronavirus. New information is constantly emerging and guidelines are continuously changing. Because of that, the education will be ongoing. So stay up to date. You can visit the Center of Disease Control website, cdc.gov, or the World Health Organization website, who.int as well. And then next page is some of the references you can refer to if you have any questions. Again, we're so excited to have you back. We're excited to be back to sports and can't wait to see you on campus. Anything else you want to add, Nate?
Nope, that's it. I hope everyone has a great, safe summer season as we get back to conditioning. Go Panthers.